The linen cart moved without sound. Sarah Chen pushed it through the fourth-floor corridor at 0200 hours, her movements calibrated for invisibility, a rhythm perfected over 3 years of night shifts at Sacred Heart. The hospital breathed differently after midnight. The fluorescent lights hummed their mechanical lullaby. The tile floor gleamed like dark water under her worn Saucony shoes, the left one slightly scuffed where she favored the good leg, the one that didn't remember shrapnel. She folded corners with precision. Hospital corners, tight enough to pass inspection, the kind of discipline that came from muscle memory she wasn't supposed to have. Her hands moved on their own, fingers that had once applied field dressings under mortar fire now smoothing creases from cotton sheets. The work was meditative. Anonymous. Invisible. Exactly what she needed. No one looked closely at night shift nurses. Sarah had learned this in her first week. The attending physicians treated the nighttime floors like afterthoughts. The residents moved through their cases like ghosts themselves, trailing stethoscopes and exhaustion. The charge nurses barely glanced up from their stations. And Sarah, quiet Sarah in the faded scrubs, the one with a slight limp, the one who kept her head down and her mouth shut, Sarah was beneath even the ghost's notice. She was restocking the crash cart on Pediatric when her phone vibrated. Not the hospital phone. The other one. The ancient flip phone that should have been destroyed 17 months ago, the one with a number that connected to exactly 3 people on Earth. She didn't answer. She checked the text instead. One word, patience. Sarah pocketed the phone and finished arranging the intubation tubes in ascending sizes, 2.0, 2.5, 3.0, 3.5, each one a whisper of a future she'd spent 18 months trying to bury. The intake log announced the admission at 0217 hours. Emma Briggs, age 9, transferred from Meadowbrook Children's Hospital in Baltimore. Presenting complaint, acute abdominal pain, etiology unknown. 3 previous hospitals. 12 different doctors. 0 diagnosis. The charge nurse, Patricia, read the notes aloud while sorting admission paperwork, her voice carrying the particular exhaustion of someone managing a mystery everyone wanted solved but no one could crack. Appendicitis was ruled out at Meadowbrook, Patricia said, scanning the file. CT showed normal appendix. Pediatric surgeon cleared her. So then they thought maybe it was anxiety. Transferred her for psychiatric evaluation. But the pain's real, Sarah. You can see it. The kid's genuinely suffering. Sarah nodded once, kept folding. She'd learned that nodding was safer than speaking. Captain Briggs, his Navy, did you see that? He's been calling every 2 hours demanding answers. Apparently he was in the operating room during her first surgery, the one that didn't find anything. The man's terrified. The admission happened at 0235 hours. Sarah was passing the pediatric unit when she saw them, a Navy captain in dress uniform despite the hour, still wearing his cover indoors, which meant he'd come straight from somewhere official. His daughter was beside him, small-framed, dark hair, holding his hand with the desperation of a child who'd already been through too much. He was checking Emma's chart when Sarah passed with a medication cart. She caught a glimpse of his handwriting, distinctive, flowing, the kind of script taught in prep schools that cost more than most nurses earned in a year. His signature sprawled across the orders, R.H. Caldwell, M.D. She'd seen that handwriting before. The memory surfaced without warning, a file she wasn't supposed to access, sitting in the basement records room while she was allegedly cleaning, pharmaceutical shipment orders signed off by someone with hospital authority. Distinctive scrawl. Initials that matched. I.H. Caldwell. Handwriting like a signature, impossible to forge, marked on shipping manifests that detailed products moving away from the hospital's inventory to destinations she'd photographed on her phone. Sarah continued moving. Medication cart rolling smooth. Head down. Invisible. But her hands had gone rigid on the cart's push handle, and it took every ounce of discipline forged in marja, in places she'd never speak about, in a lifetime she'd been ordered to erase, to keep moving as if nothing had shifted. Emma screamed at 03 for 7 hours. Not a cry. Not distress. A genuine scream of pain that brought 3 nurses running. Sarah was in the supply closet restocking when she heard it, that particular quality of suffering that comes from a child in genuine crisis, the kind of sound a parent never forgets, the kind of sound that echoed through tile corridors and into the worst parts of memory. She emerged to find Captain Briggs holding his daughter while Emma sobbed into his shoulder, her small body racked with pain she couldn't articulate, pain she didn't understand, pain that 12 different doctors had looked at and failed to name. Patricia was reviewing the previous night's workup, abdominal imaging, blood work, psychiatric assessment, everything coming back normal or inconclusive. The resident on call, Dr. Marcus Chen, no relation to Sarah, a fact she'd verified her first week, was ordering another round of labs. Exploratory approach. Trial and error. The worst kind of medicine that happened to suffering children while their parents watched helplessly. Sarah wheeled the supply cart past Emma's room without stopping. But her eyes caught on the girl's presentation as she moved, and what she saw made the back of her neck tighten in a way she hadn't experienced since Kandahar. The pain was localized. Not diffuse abdominal pain. The girl was holding her right flank, upper quadrant, protecting something specific. And when she moved, when Captain Briggs helped her shift position, Sarah saw the subtle darkening on the girl's skin, a discoloration that looked like bruising beginning under the surface. Internal bleeding. Not massive. Not yet. But present. Active. Getting worse with each hour that passed while 12 doctors debated appendicitis and anxiety and every diagnosis that wasn't the real one. Sarah continued to the next room. Invisible. Unremarkable. The night shift nurse with the limp, the one nobody asked questions about, the one who folded linens and restocked supplies and knew better than to speak up. But her mind was calculating. Ruptured spleen. Abdominal trauma from something, blunt force, a fall, something the intake history hadn't captured. Bleeding into the peritoneal cavity. Blood loss of maybe 400 milliliters by now, maybe 600. At the current rate of increase, the child was looking at hemorrhagic shock within 12 hours if the bleeding continued unchecked. The morning shift would arrive in 5 hours and 13 minutes. Emma Briggs had maybe 9 hours after that before the situation became critical. Sarah folded linens in the supply closet and thought about the faded unit patch sewn inside her jacket lining against her ribcage, hidden the way everything about her was hidden. The patch from 2nd Battalion, 5th Marines, sewn into the lining by a quartermaster in Helm and Province who'd given her the jacket and made her promise to survive. She'd promised a lot of things. She'd promised the Navy she'd disappear. She'd promised herself she wouldn't help anyone. She'd promised that the person she used to be would stay buried under 3 years of invisible night shifts in Philadelphia. But Emma Briggs was 9 years old and bleeding into her abdomen while 12 doctors argued about anxiety, and Captain Briggs was standing in a pediatric room at 03 for 7 hours in a Navy dress uniform, holding his daughter like she might slip away. Sarah had seen soldiers die from less. The night shift clock showed 0402 hours. The room went dead silent except for the ventilators and the fluorescent lights humming their mechanical song, and somewhere in the walls, the sound of a child's breathing getting shallower with each passing hour. The morning shift arrived at 0630 hours, and Sarah Chen stood in the medication room counting vials she'd already counted twice. The pharmaceutical inventory report sat on the metal counter in front of her, numbers that didn't reconcile, not by much, just enough that her eyes, trained by years of field protocols to spot discrepancies, caught the pattern. 50 milliliters of fentanyl. 300 milligrams of morphine. 2 vials of midazolam. All logged out over the past week, all attributed to patients in the ICU who hadn't received them according to the administration records she could still access from her terminal during night shifts. She'd been a major in the Navy Medical Corps for 12 years. Invisible counted inventory problems the way combat medics counted respiratory rates, as data, as information, as truth. She documented nothing, said nothing, just noted the pattern in the careful architecture of her memory. The kind of memory that survived 3 tours in Helm and Province. The night shift handoff started at 0700. Sarah sat at the nurse's station with 8 other staff members while the day shift charge nurse, Patricia, read the census report. Routine. Stable. 2 admissions, 1 discharge. Emma Briggs still on the pediatric floor, still screaming, still undiagnosed. Sarah listened to the attending's assessment, possible anxiety disorder, recommend psychiatric consultation. The words landed like bullets in still water. She raised her hand slightly. The pharmaceutical counts in the ICU don't match the administration records for the past 7 days. Patricia's pen paused mid-note. The room didn't move. Specifically, she asked, her voice careful. Fentanyl. Morphine. Midazolam. The quantities logged don't align with documented patient administrations. Sarah's voice didn't rise. She'd learned years ago that precision didn't require volume. 50 milliliters over 7 days. That's significant enough to warrant a reconciliation before the quarterly audit. The fluorescent lights buzzed above them, that low electrical hum that never quite stopped, the background radiation of every hospital in America. Patricia made a note. The handoff continued. Nobody else spoke to her for the remaining 20 minutes. But Dr. Raymond Caldwell, standing at the far end of the nurse's station reviewing lab results, looked up slowly. His eyes moved to Sarah's face, and something shifted behind them, not anger, something colder. Recognition. The kind of recognition that comes when you've been caught and you understand exactly who caught you. At 0745 hours, the overhead page crackled to life. Chen, the night owl, report to administration. Chen, the night owl, report to administration immediately. His voice on the intercom was different from his clinical tone, layered with something that sounded like amusement, like he was sharing a private joke with everyone who heard it. And everyone heard it. The nickname hung in the air like chemical vapor, visible to every nurse on every floor who'd ever wondered why the night shift nurse never socialized, never attended the holiday parties, never mentioned a life outside these corridors. The night owl. The bird that hunted in darkness. Sarah closed the medication chart. She stood without hurrying. She walked down the hallway with the same measured pace she used entering a trauma bay, controlled, purposeful, the kind of gait that doesn't telegraph emotion. Her hands were steady. Her breath was steady. The tear that wanted to come didn't arrive yet, not here, not where anyone could see it. The administrator's office was on the 4th floor. The elevator ride took 90 seconds. She counted them silently, the way she'd learned to count time in desert heat, marking the seconds until extraction. Dr. Caldwell was already inside, standing beside the administrator's desk with his arms crossed. His posture was a sculpture of authority, the kind that required witnesses. The administrator, a woman named Ms. Reeves with grey hair and the exhausted expression of someone managing a 200-bed facility on inadequate staff, gestured to the chair across from her. Not beside it. Opposite it. A configuration designed to position Sarah lower, farther, alone. Sarah, Ms. Reeves began, we've had some concerns raised about your performance metrics. What kind of concerns? Sarah sat down. Her voice came from the same place it had in Marja, low, even, the vocal cords of someone who'd learned that excess emotion was a luxury that got people killed. Dr. Caldwell moved slightly forward. Your overactive imagination regarding supply chain management, for one. You're a night nurse, Sarah. Your role is to dispense medications, monitor vitals, maintain patient dignity. You're not a pharmacist. You're not an auditor. You don't have the qualifications to flag inventory discrepancies or question controlled substance distribution. He smiled. It was the kind of smile that had no warmth in it, the smile of someone explaining why you couldn't possibly understand something he found obvious. This obsession with paperwork suggests you're compensating for clinical inadequacy. You're trying to look competent by auditing rather than by actually doing your job. Sarah took one measured breath. The air tasted like recycled climate control and the faint medical smell of antiseptic that lived in hospital walls. She met his eyes and held them. I see. Effective immediately, Ms. Reeves said, you'll be transferred to intake processing. This will allow you to focus on your core competencies. Translation: he was removing her from the ward where she could see medication logs. Removing her from proximity to whatever pipeline he'd established. Sarah stood. Understood. She walked out of the office at the same pace she'd walked in. The elevator down to the second floor took 53 seconds. She counted every one. 2 days passed like machinery, intake processing work that required nothing but her body. Patients arriving, paperwork filed, vital signs recorded, none of it touching the part of her that was still thinking, still calculating. She'd spent the night hours in the hospital's back-archived records system, the one with outdated security protocols, photographing pharmaceutical order forms with her phone. Caldwell's handwriting was distinctive, precise, angular, with a particular way of forming his lowercase t that looked like a rifle sight. She'd seen that same handwriting on the diverted controlled substance orders in a file she accessed through a terminal that still carried her old clearance credentials from when she'd been something other than a night nurse. The hospital had never properly deactivated her administrator access. $47,000 in pharmaceutical theft over 6 months. Maybe more. She didn't know the full picture yet. But the edges were connecting. The next humiliation came on day 3, when she was retrieving new medication supplies from the central pharmacy. Dr. Caldwell appeared in the medication room doorway like an actor stepping into precisely planned light. The pharmacy tech was restocking shelves 10 feet away, within hearing distance. He angled his body so he could be seen but not quite overheard, voice low and cutting, the kind of quiet that carries further than shouting. "I've been reviewing your evaluation file," he said. "Your clinical assessments over the past 3 years show a pattern of mediocrity at best. 12 night shifts with incident reports. 16 with medication administration delays. You have ideas above your station, Sarah. That's not modesty, that's reality. Your obsession with paperwork, with audits, with things that aren't your responsibility, frankly, it suggests you're compensating for the fact that you're not a very good nurse." Sarah reached for a box of gauze. Her hands didn't shake. Her jaw tightened, but that wasn't visible, just a small muscular action nobody would detect unless they were trained to read tension in a human body. A single tear tracked down her left cheek. It was involuntary, autonomic, the kind of physical response she couldn't suppress no matter how many years she'd spent learning to suppress everything else. She reached up and wiped it with her thumb, the motion precise, controlled, her eyes never leaving his. "You must be terrified of what I represent," she said quietly, "if this is how far you'll go." The words landed like ice water. She saw him process them, saw the flash of uncertainty cross his face, the moment where he realized he'd been recognized. Not as a victim of her threat, but as a predator who'd finally been seen clearly. He turned and walked away without responding. The final strike came that afternoon at shift change, when the morning nurses arrived and the parking lot filled with arriving staff. Sarah was walking to her car, her badge clipped to her jacket, when Dr. Caldwell emerged from the building with his own bag. He made sure he was positioned to intercept her. Made sure the arriving staff could see and hear. His voice carried across the asphalt like a public announcement. "Sarah, I need to inform you that effective immediately, you're being transferred to intake processing full-time. We've realized that patient care requires a higher level of clinical skill than you're able to provide. Intake processing is a better fit for your capabilities." 20 staff members stopped to listen. 20 witnesses to her public demotion. 20 people who would carry the message that Sarah Chen, the night shift nurse, had been demoted for incompetence. She nodded once. She didn't speak. She turned and continued to her car with perfect posture, her spine straight, her gait controlled. Only her hands trembled, small, subtle shaking that she buried in her jacket pockets. She could feel his satisfaction from 30 feet away. He'd accomplished exactly what he intended, silencing her, isolating her, making her look unstable enough that nobody would believe her if she raised concerns about the pharmaceutical diversions. Nobody would believe a demoted nurse. A competence-questioned nurse. A nurse with a demeaning nickname the entire floor now knew by heart. She drove home through Philadelphia traffic, rain beginning to fall, the city sliding past her windshield like a sequence of moments she wasn't quite present for. At 18:47 hours, sitting in her apartment with a laptop and coffee growing cold, she pulled up the photographs she'd taken, the pharmaceutical orders, the handwriting, the timeline of diversions that aligned perfectly with Caldwell's rotation schedule. $47,000. But that wasn't what made her hands move across the keyboard, isn't what made her begin pulling together the architecture of evidence that had been invisible to everyone except her. It was Emma Briggs, the 9-year-old daughter of Captain Marcus Briggs, still screaming in a hospital bed that Sarah could no longer access. Still undiagnosed. Still deteriorating. And somewhere in Sacred Heart, Dr. Raymond Caldwell was removing the only person who'd figured out what was wrong with her. Not because he cared about the child, but because Sarah represented something he couldn't control. The night owl had been grounded. But a grounded bird is a dangerous thing. The alarm sounded at 0300 hours. 3 floors up from intake processing, Sarah heard it through the ceiling tiles, that particular pitch of the pediatric unit's crisis alert, the one that meant a child was crashing. She was standing in the dim laundry room folding scrubs that no longer belonged to her, her badge deactivated in her locker, her access to that floor digitally locked out. The intercom crackled. Code Blue, Pediatric ICU, Bed 4. Code Blue, Bed 4. Not a request. Not a general alert. A specific bed number that made every muscle in her body recognize what was happening before her mind caught up. Bed 4. Emma Briggs. The little girl whose belly was distended with blood, whose eyes had looked up at Sarah with the kind of trust that comes from a 7-year-old understanding that this nurse, this one quiet nurse in faded scrubs, was the only person in the entire hospital who believed her. Sarah moved. Not walked. Not jogged. Moved like something with purpose, with precision, boots hitting linoleum in a rhythm that sounded like bullets on a hardwood floor in Marja. Down the hallway. Up the service stairwell, 2 steps at a time, her hand barely touching the railing. Her leg didn't burn. Her scar tissue didn't complain. Pain was information. Pain was data. And every synapse firing in her body was screaming one message: get to that child. The security door to the pediatric unit required a badge swipe. Sarah had neither badge nor authorization. She had something better. She had muscle memory from 18 months of training at Coronado. She had the kind of calm that comes from having already survived worse. She slipped through the automatic doors on the heels of a resident pushing a crash cart, invisible in the controlled chaos. The pediatric ICU smelled like antiseptic and fear. Those 2 things shouldn't mix, but they did, that particular sharp tang of bleach cut with something copper and wet. Emma lay in bed 4, her small frame dwarfed by the equipment surrounding her, her skin the color of wet newspaper. The ventilator wheezed its mechanical rhythm. The heart monitor screamed in a pattern that shouldn't exist, erratic, frantic, a metronome wound too tight. Her blood pressure was 70/40. Her oxygen saturation was dropping, 89%, 84%, 78%. The on-call resident, Dr. Patel, stood at the foot of the bed with his hands hovering uselessly, his mouth moving without producing sounds that meant anything. He was a competent doctor in routine circumstances. This was not routine. This required someone who had held a 19-year-old Marine's torso together with bare hands and a prayer while rounds of automatic fire kicked up dust around a forward operating base. As standing by, someone said, "Calling surgery." "She's not waiting for surgery," Sarah said. Her voice didn't sound like the quiet nurse from intake processing. It sounded like someone who had spent for months in a place where hesitation got people killed. She pushed past Dr. Patel, her hands already moving, already reading Emma's abdomen like an instrument panel. Distended. Rigid. Rebound tenderness that made the child's entire body go rigid. The spleen had ruptured. Sarah could feel it in the tension of the tissue, in the way Emma's body was compensating, in the frantic pulse of shock trying to dump enough oxygen to a dying organ system. Ruptured spleen. She's bleeding into her abdomen. She's got 6 minutes before her heart can't compensate anymore. Dr. Patel stared. You can't, Dr. Caldwell said you're not supposed to. Sarah didn't hear him. She was already positioning Emma into recovery position, rolling the child to her left side, creating a natural compression angle. Her hands moved with the terrifying fluid precision of a trauma surgeon who had been tested in the worst classroom on earth. She applied direct abdominal pressure, not with panic, not with force, but with the exact tension required to slow bleeding without causing additional damage. It was a technique that shouldn't exist in a pediatric hospital in Philadelphia. It was a technique that existed because it had saved 17 lives in a desert where the only operating room was under fire. Call surgery. Call trauma. Do it now, Sarah said. Her voice carried command authority, not a request, not a suggestion. A statement of fact spoken by someone who had already made a decision about whether this child was going to live or die. 1.5 liter fluids, 0.5 of whole blood, push 1 milligram epi if the rhythm deteriorates. The resident moved. His hand stopped hovering and became functional. The nurse at the computer station was already on the phone. Captain Marcus Briggs, who had been dozing in the chair beside his daughter's bed, came awake all at once, the way military fathers do, aware instantly that something had changed, that the danger was no longer theoretical. He watched this night nurse move around his daughter with hands that didn't shake, with movements that carried absolute certainty, with knowledge that shouldn't exist in someone in a hospital gown color that nobody with real authority wore. Emma's blood pressure climbed. 72, 74. 76, her oxygen saturation steadied at 88%, not good, but stable. Stable meant she had minutes instead of seconds. Stable meant surgery could happen. The surgical team hit the unit at 0307 hours, 7 minutes from crisis start, moving with their own version of choreography. They took over. Sarah stepped back, her hands finally releasing their pressure on Emma's abdomen, and that was when her body remembered that it was human. That was when the trembling started, but it wasn't fear. It was the neurochemical aftermath of having your nervous system flooded with adrenaline and purpose. Her hands shook because they knew exactly what they had just done, and they were shocked that it had worked. Again. Still. After all this time. Captain Briggs looked at her. His eyes held the comprehension of someone trained to recognize combat competence in a theater where combat had no uniform. He didn't speak. He didn't have words that mattered. Instead, he gripped Sarah's shoulder, just once, just long enough to communicate that he had seen something he couldn't explain, and that whatever it was, it had saved his daughter's life. Emma was wheeled to surgery at 0312 hours. The ruptured spleen required removal, but the bleeding was controlled. The child would live. That was the only number that mattered, and Sarah didn't allow herself to watch the elevator doors close behind the surgical team. She turned away from Captain Briggs' gratitude and walked back toward the stairwell because that was what the script required. That was what invisibility demanded. That was what. The voice behind her was calm. Professional. Terrible in its control. Major Chen. Sarah stopped. She didn't turn around. She already knew what Dr. Caldwell's face would look like. She already knew the 3 phone calls he was about to make, the sequence of them, the precision of his strategy. She had met men like him before, men who responded to losing control by tightening their grip until something broke. You're aware that you've been reassigned to intake processing, Dr. Caldwell said. He wasn't asking a question. His hands were steady. His voice was steady. The only thing that betrayed him was the vein at his temple, the one that was working overtime. You're aware that you don't have authorization to be on this floor. Sarah turned. She looked at him the way she had learned to look at things in Marja, not with anger, not with fear, but with the kind of clarity that comes from understanding that you're looking at something that's already dead, it just hasn't recognized that fact yet. That child was going to die. That child was under Dr. Patel's care. Caldwell's voice dropped an octave. It was a voice trained in the art of sounding reasonable while committing unreasonable acts. Your involvement is going to require an investigation. Serious violations of protocol. Overstepping your qualifications. Sarah didn't respond. She had learned long ago that when someone was terrified, talking only gave them time to build a narrative. Better to let them speak themselves into corner they dug themselves into. Caldwell reached into his pocket, pulled out his phone, and made the first call in what would become a coordinated dismantling. "This is Dr. Caldwell. I need to report a serious incident involving an unauthorized staff member interfering with patient care. Suspend her access immediately." "Yes. Right now." He hung up and made the second call before Sarah could move. Then the third. Each one was delivered in that same calm voice, each one containing just enough of the truth to sound like the whole truth, each one strategically removing her from the building like a tumor being extracted from healthy tissue. Sarah heard the security footsteps coming down the hallway before she saw them. She knew what came next. She had known what came next the moment she heard Emma's heart monitor screaming. She had chosen anyway. She would choose the same way again. That was the only constant anymore, the choices that cost something, the ones that nobody would ever thank her for, the ones that came because there was no other option. But that wasn't the worst part. The worst part came at 0400 hours, when she was standing in the locker room with 2 security guards waiting while she emptied her locker. Her badge was already dark. Her access was already revoked. Her name was already being removed from the system. And in her jacket, still hanging on the hook where she'd left it at the start of her shift, was the faded unit patch sewn into the lining. The only proof she'd ever been anyone other than just a nurse. Dr. Caldwell appeared in the pediatric ICU within minutes of Emma's stabilization, his surgical mask already removed, his eyes calculating with the precision of someone 3 moves ahead of everyone else in the room. He moved past the monitors still beeping their steady rhythm, past the nurses checking lines, past the evidence of Sarah's hand keeping a child alive, and his gaze settled on the attending physician with the expression of a man who had already written the narrative and was simply waiting for others to read it aloud. By 0630 hours, before the morning shift change, he'd made 3 phone calls from the administrator's office. The first was to the hospital's legal department. The second was to the chief of medicine. The third was to someone whose voice on the other end apparently mattered more than protocol, more than procedure, more than a child's life hanging in the balance. Within 90 minutes, the wheels were already turning. Not because Sarah had overstepped, she had saved a life with the methodical precision of someone who had done it before, someone whose hands knew exactly where to push, exactly what to do. But because Dr. Caldwell had spent 8 months building a fortress of allies, and he was going to use every brick. The administrator's office at 0800 hours was sterile in a way the hospital floors never were. Wood paneling. Leather chairs. A window that looked out over Philadelphia's skyline in the early morning light. Sarah sat in one of those chairs, still in her scrubs, the fabric damp from the emergency, her scrub cap stuffed into her pocket. She hadn't slept. 48 hours awake on her feet, and her body felt like it belonged to someone else, numb, floating, disconnected from what was about to happen. Dr. Caldwell sat across from her with a folder in his lap. His posture was relaxed. Casual. The posture of someone confident in his position, someone who had already won before the conversation started. Administrator Chen, no relation to Sarah, a distinction that would matter in the next 8 minutes, sat behind his desk looking exhausted, like he'd been awake most of the night fielding phone calls from people important enough to call him at home. "Sarah," Caldwell began, his voice smooth as a scalpel. "We need to discuss what happened in the ICU last night." Sarah said nothing. Her hands rested on her knees. Her breathing was even. "You performed procedures outside your scope of practice," Caldwell continued, opening the folder with deliberate slowness. "You disregarded direct orders from attending physicians. You accessed patient files you were not assigned to. You created a hostile work environment through unfounded accusations about senior staff." Each statement landed like a hammer blow, except nobody in the room flinched. "I have documentation of all of this. Nurses willing to testify about your erratic behavior. Security footage of you accessing restricted areas." Administrator Chen looked at Sarah with something that might have been pity. These are serious allegations. The hospital has a responsibility to investigate. Effective immediately, you're suspended without pay, pending a full investigation. Security will escort you out. Sarah stood. Her legs were steady despite the exhaustion, despite the weight of what was happening. Dr. Caldwell has been diverting controlled substances from this hospital for 8 months. Caldwell didn't flinch. His expression didn't change. That was the truly terrifying part. He was ready for this. Classic deflection from someone facing termination. Sarah has exhibited paranoid behavior for weeks. Increasingly erratic decision-making. I have 3 psychiatric professionals prepared to testify to her instability. This kind of accusation, he paused, turning to Administrator Chen with genuine concern etched across his face. It's concerning. I worry about her well-being. I really do. The administrator's shoulders sagged. He'd already made his calls too, his own calculations. Caldwell's allies went higher than Sarah's evidence went deep. I'm sorry, Sarah. I need you to go with security now. We'll be in touch about next steps. The escort to the locker room was quiet. A security guard Sarah had nodded to for 3 years didn't make eye contact as she walked past the nursing stations, past the faces of people she'd worked with for 36 months. Some of them looked away. Some looked straight through her, as if she was already a ghost. The locker room smelled like old metal and the faint chemical tinge of antiseptic that seemed to seep into everything at Sacred Heart. Sarah changed slowly, deliberately, folding her scrubs with the precision she'd learned in a different life. The top fold. The sides tucked inward. The pants rolled with military efficiency. As she folded, the jacket shifted against her body, and for just a moment, the light caught the faded threads of the unit patch sewn into the lining, 2nd Battalion, the insignia worn nearly smooth by 3 years of fabric rubbing against it in the dark. The only proof she'd ever been Major Sarah Chen. The only evidence that mattered. She carried the folded scrubs to the laundry room herself. The fluorescent lights hummed their usual frequency, the sound so constant that most people forgot to hear it, but Sarah noticed everything. She noticed how the laundry worker, a woman named Dolores who'd given Sarah coffee when she worked a triple shift 6 months ago, wouldn't meet her eyes. How the stainless steel sorting tables gleamed under the harsh light like surgical instruments waiting for use. How the smell of bleach seemed stronger this morning, sharper, almost aggressive. Sarah set the folded scrubs on the metal table where contaminated linens got sorted. Where hospital staff placed the evidence of their labor, the sweat and blood and bodily fluid soaked into cotton, to be cleaned and reused by people the hospital would never thank. She stood there for a moment, looking at the scrubs that had hung in her locker every single day for 36 months. The name badge on the pocket that said Sarah Chen, RN. The ID number, 47392. The hospital logo fading from repeated washing. Dolores finally looked up. You okay? Yeah, Sarah said quietly. Her voice was steady. I'm okay. She wasn't thinking about the suspension. Wasn't thinking about Caldwell's 3 phone calls or the psychiatric professionals he'd already lined up or the strategic brilliance of his preemptive character assassination. She was thinking about Emma Briggs, about the sound of the child's breathing when the endotracheal tube was properly placed, about the way a small girl's chest rose and fell in the rhythm of a ventilator at 0312 hours. About the fact that Emma was alive, and that was the only calculation that mattered. Sarah had been ordered to disappear after Marja. After the classified operation where Major Sarah Chen had saved 17 lives went so catastrophically wrong that the Navy buried the entire mission, erased her from official records, sealed the documentation, and told her never to surface. Never to use her training. Never to exist as anything but a ghost in the civilian world, where she could help people without anyone knowing she was there. Where she could keep quiet and keep invisible and keep alive the parts of herself that wanted to save lives without anyone asking why she knew how. She had violated that order last night. She had broken every protocol, every promise, every condition of her civilian existence. She had let the Major out for long enough to save a child's life, and now the price was exile, again. The employee entrance at dawn was empty except for the security cameras recording her final exit. Sarah pushed through the glass doors, the cool Philadelphia morning air hitting her face like a reset, and she didn't look back. The jacket hung loose over her shoulders, the faded unit patch hidden in the lining where it would stay, where it would wait, where it would be the only proof that any of this had happened at all. Behind her, in the pediatric ICU on the 4th floor of Sacred Heart Hospital, Emma Briggs slept the deep sleep of a child whose spleen had been saved, whose blood supply had been restored, whose life had been given back by a nurse everyone else had dismissed. The monitors beeped their steady rhythm. The machines hummed their mechanical songs. And no one in the hospital yet knew that they were standing next to a legend. But that was going to change. The algorithm flagged it at 2:44 a.m. A classified security clearance registered in the Sacred Heart Hospital database, impossible on its face, a digital ghost that shouldn't exist in civilian systems. The flag migrated automatically up the chain, from IT infrastructure to the hospital administrator's secure email, landing in her inbox at 6:14 a.m. on the same morning. Captain Marcus Briggs stood in front of 17 news cameras describing how 12 different doctors had failed his daughter. The administrator read the name twice. Sarah Chen. The same name flagged in that personnel file requisition from 3 days ago. The same nurse suspended for procedural violations. The same woman Caldwell had publicly dismantled. On the live broadcast, Captain Briggs' voice cracked. Emma was screaming. Screaming for 6 hours while the specialists ran tests and attributed her pain to anxiety. To anxiety. His dress whites were immaculate. His jaw was clenched so tight the veins at his temple pulsed like a second heartbeat. And then one nurse, one person, walked into that room and saved my daughter's life. And your hospital destroyed her for it. The camera cut to Emma, pale and small in her hospital bed, wires trailing like spider silk. She was 9 years old and already wise to the cost of truth. When the reporter asked her what she remembered about her nurse, Emma looked directly into the lens with the clarity of children who have learned things no child should learn. The nurse told me she was a major once, Emma said. She told me that sometimes people know things other people don't know. She told me pain is information. And then she saved me. In the administrator's office, the floor nurse, Rita, the one with trembling hands who had always noticed things, saw the email alert. Saw the timestamp. Saw the flag clearance level and the classification code that made her own security clearance feel like a library card in comparison. She didn't ask permission. She walked to personnel, pulled the file, and her hands began to shake not from fear but from the magnitude of what she was holding. The commendations were dense as a battlefield report. Bronze Star for Valor under fire. Silver Star for leadership during combat evacuation. 2 Purple Hearts, separate incidents, separate scar stories. The file listed unit assignments, 3rd Battalion, 5th Marines, deployed Marja, Helmand Province, 2009 to 2011. It listed her rank as Major, retired status, classified to active civilian duty per Navy SEAL Task Force authorization. It listed psychiatric clearance for undercover assignment. It listed 847 days of continuous observation on pharmaceutical diversion patterns at 3 Philadelphia area hospitals. Rita's voice shook when she read it aloud to the assembled floor staff who had gathered after the broadcast went viral. Her voice didn't shake from crying. It shook from the weight of having been standing next to a legend and calling her the Night Owl. The newsroom phones exploded. 17 calls in 4 minutes, all military-related, all incoming. One of those calls came from Master Chief Torres, retired from Naval Special Warfare Command, calling from a secure line in Virginia. He had been Sarah Chen's commanding officer. He had watched her take a bullet meant for a younger Marine and keep operating the trauma kit with her left hand while her right hand hung useless. "I'm calling to confirm," Master Chief Torres said into the live broadcast feed, his voice carrying the particular steel of someone who had held his people's lives in his hands, that Major Sarah Chen earned a Silver Star for actions during Operation Enduring Freedom. "I'm calling to confirm she earned 2 Purple Hearts in the same 15-month period. And I'm calling to tell you that she's the most competent person I've ever served with, civilian or military." The hospital administrator's phone rang at the same moment. It was Special Agent Foster from the Federal Bureau of Investigation, Pharmaceutical Crimes Division. His voice was clipped, professional, devoid of apology. "Your hospital is sitting on a civilian undercover operative," he said, "who has been gathering evidence on Dr. Raymond Caldwell for 6 months under direct FBI authorization. She was embedded at your facility to document pharmaceutical diversion at 3 hospitals across the region. Caldwell diverted $847,000 worth of controlled substances. We have 17 arrests pending across those institutions. And you just suspended her." The silence on that call lasted exactly 3 seconds. "Then, we need her back on that floor. Now." Dr. Caldwell had woken that morning confident. He had gone on the morning show, local news, nothing national, easily controlled, and described Sarah as a disturbed individual with hero fantasies, confabulating military service to compensate for an unfulfilled life. He had smiled for the camera. He had worn his tailored suit. He had believed, absolutely, that he had contained the situation. By 8:41 a.m., he was watching the broadcast from his office at Sacred Heart, watching Master Chief Torres name his subordinates medals, watching his own words play back alongside footage of Sarah's classified file being read aloud by a nurse with tears streaming down her face. The camera held on her for 5 seconds where the world could see the truth of something they had dismissed as invisible. The FBI knocked on his door at 9:14 a.m. 2 agents, professional courtesy before the raid teams descended on his home 40 miles away. They found the diversion logs. They found the offshore account setup. They found the prescription pad stashed in a locked drawer, the same distinctive scrawl Sarah had seen on the pharmaceutical shipment orders. By noon, his attorney was advising a plea agreement. By evening, his medical license was voluntarily surrendered to avoid the humiliation of formal revocation. By the end of the week, the psychiatric professionals he'd contacted to testify about Sarah's mental instability were filing ethics complaints against him for attempting to weaponize mental health diagnoses. The hospital's board of directors held an emergency meeting. Their attorneys outlined the legal exposure with surgical precision, the reassigned staff, the altered schedules, the documented restrictions on Sarah's access to the pediatric ward. Each decision created a traceable obstruction pattern that directly endangered Emma Briggs and potentially dozens of other pediatric patients. Captain Briggs' legal team was already preparing a lawsuit. The institution announced that it would not defend Caldwell. He was legally isolated, a ship cut loose to sink or swim alone in waters he had no idea how to navigate. 3 months later, a local news crew doing a follow-up story on the scandal spotted Dr. Raymond Caldwell at a strip mall on Route 9 outside Philadelphia. He sat at a folding table with a laminated banner reading affordable insurance quotes. He wore a cheap polo shirt, wrinkled, the kind sold in bulk packs. His hair had started graying at the temples in ways his salary had previously prevented. When customers approached, he didn't make eye contact. His hand shook slightly, not from any dramatic cause, but from the simple weight of becoming ordinary. The news footage aired without commentary, just 10 seconds of a once powerful surgeon cold-calling strangers about car insurance. The segment ran between a story about potholes and a human interest piece about a cat rescue. Nobody needed to explain what they were watching. The comparison was automatic: the man in the cheap polo shirt, alone at a folding table, and the major whose medals now hung in hospital records visible to anyone with access clearance. Inside Sacred Heart, renovations were already complete. The bronze plaque had been cast and installed above the newly refurbished pediatric nurses' station, the Major Sarah Chen Pediatric Wing. Dedicated to service. In recognition of Valor both seen and unseen. Sarah stood at that station on the morning of the dedication ceremony, wearing scrubs with her name and rank embroidered clearly on the chest, Major Sarah Chen, USN, RET. Her call sign had been Nighthawk. Her service record had been sealed. Her identity had been buried so deep that only a classified security flag in a civilian hospital database could resurrect it. Emma Briggs walked up to her in front of 70 assembled hospital staff and military personnel. The 9-year-old girl, dressed in a junior Navy League uniform, executed a perfect salute with her small right hand. Sarah returned the salute and then knelt, and for the first time in 3 years, she let herself be seen exactly as she was, a person who had held lives together in 2 very different wars, one in a desert 13 years ago, one in a fluorescent-lit pediatric ward 3 months ago. Captain Briggs approached afterward and shook her hand. His grip was firm, the grip of someone who recognized authority without needing rank insignia to identify it. "You violated direct orders to save my daughter," he said quietly. "I'm told that's not the first time you've done that." Sarah felt her mouth curve slightly at the edges. Not quite a smile, something older and harder and more honest. "No, sir," she said. "It's not." Master Chief Torres stood in the back of the ceremony, and when their eyes met across the room, he nodded once, the kind of nod that carries the weight of every mission, every decision, every person brought home alive because someone refused to follow the rule that said they should have died. Rita, promoted to assistant charge nurse of the pediatric wing, made a speech about how institutions sometimes fail to see the value of the quietest people in the room, and how some people are erased not because they lacked courage but because they possessed more of it than the systems around them could tolerate. That evening, Sarah sat alone in her new office, a small space with a window overlooking the pediatric gardens, and opened a package that had been left on her desk. Inside were her old scrubs, cleaned and pressed, the one she had folded in the laundry room at her lowest moment. The laundry worker, the man who wouldn't make eye contact, had attached a handwritten note in careful block letters, "I knew you were someone. I just knew." Sarah hung those scrubs in her locker next to her dress uniform, the faded 2nd Battalion unit patch no longer hidden but displayed openly. 2 identities, no longer choosing between them but embodying both, the ghost who saved lives in Marja, and the nurse who refused to let a child die in Philadelphia. The quietest person in the room had never actually been powerless. She had simply been waiting for the moment when keeping silent became more costly than speaking the truth. She made night rounds that evening, walking the pediatric wing with her limp barely noticeable now, her hand steady as surgical lasers, checking on sleeping children. One of them stirred as she passed, not Emma, but a boy admitted with pneumonia. He opened his eyes and looked at her with the clarity of children on painkillers, unguarded and honest. "Are you the major?" he asked. Sarah paused at his bedside, her hand resting on the bed rail, and for the first time in her life, she didn't deflect. "Yes," she said. "I am." Subscribe to this channel for more stories of overlooked heroism. Like if you've ever been underestimated by someone who didn't know your full story. Comment below, have you ever judged someone only to find out you were completely wrong about who they were?